Hi, thanks for joining us today to talk about our new policy report on elder care. For those of you who don't know me, I'm Anna Nienhuis. I have been working for ARPA and We Need a Law for about 5 years and recently had the task of drafting this report on elder care. I guess I got pretty vocally excited about the issue because then I was given the honor of introducing it to all of you. So this policy report looks at how Canada, and we as Canadians, can do better when it comes to elder care. So specifically those who can no longer live independently based on their age. This topic ended up being even more relevant than we could have predicted at the beginning of the year, as we've seen COVID disproportionately impact seniors, both the disease itself as well as the restrictions around it. So a lot of people in Canada are talking about elder care and how we can do better. So we want to offer a Christian perspective on what better looks like. And what we don't think it looks like is a fully government program where people can have euthanasia and they run everything. So for a quick outline of where we're going today, I want to talk about, first of all, a biblical perspective on elder care, what our responsibility is when it comes to elder care, and that's going to tie into the primary role of family in elder care. Then we're going to look at long-term care, and then more specifically about the issue of choice in long-term care, or the importance of choice in long-term care. Throughout this, we're kind of going to talk about the government's role in it and what kind of policies we're recommending. And after this, my colleague Andre is going to be joining me for some questions and discussion. So if you have questions as we go along, feel free to put them in the comment section and we'll try to get to them. So elder care is a topic that's close to many of our hearts. So many of us have elderly loved ones, either in our families, in our churches, living with us, living near us in assisted living facilities. So these are my beautiful grandparents. My grandma just turned 90 this year. I thought of them often while writing this report and was able to get their input on the report. So we all have these people in our families, in our churches, in our communities, and we want to know how to care for them well. We're also all aging ourselves, so this is a topic that's going to impact all of us eventually. So before making any recommendations, we need to clarify what is a biblical perspective on elder care. Maybe your first thought is from the commandments, honor your father and mother. And that is a great starting point. We hear it all the time, every Sunday, and we are called and commanded to honor our parents all the days of their lives. The Bible has a lot more to add to this command. So Leviticus 19, verse 32, calls us to stand up in the presence of the aged, show respect for the elderly, and revere your God. I am the Lord. So what we notice here is, again, this is a command. Stand up. Show respect. And this respect for the elderly is paired with reverence for God. The two go hand in hand. Throughout the Old Testament, both the law and the prophets, the Lord makes it clear that his people are expected to care for the vulnerable among them, particularly widows and widowers. And in the Old Testament, caring for vulnerable people was to be a defining characteristic of the people of God. This focus does not change in the New Testament. 1 Timothy 5, verse 4 says, give proper recognition to those widows who are really in need. But if a widow has children or grandchildren, these should learn, first of all, to put their religion into practice by caring for their own family, and so repaying their parents and grandparents, for this is pleasing to God. So again, here we see the focus on family and that intergenerational caring. In Mark 7, verse 6 to 13, Jesus confronts the religious leaders for believing they are safe in their pious traditions while they fail to care for their own elderly family members. So it's clear from a lot of scripture that our calling and responsibility to care for our elders is part of right Christian living. We as Christians are still to be a community defined by how we care for others. So how can we encourage our government to support this kind of family-first care? And what kind of policies can we promote that support family-first care? So let's talk about what I mean by family on the front lines of elder care. Our policy report starts out with this. Families should care for their aging elders at home for as long as possible and remain active participants in their care if they enter a long-term care facility. This means family is involved in elder care right up until the very end. This is a really unique time right now, as COVID-19 has actually taken away our biblical calling to care for our parents, to visit the sick, to care for the elderly, to care for widows. Well, not taken away the calling, but taken away the opportunity to fulfill that calling in many of the ways we're used to. And we are being denied this opportunity not because there is no need for care, but because the government thinks it can do a better job, or it's safer for them to do that job. One woman responding to a survey mid-pandemic expressed the government takeover of family responsibility this way. She says, my mother is 98 years old and I am her daughter. Unfortunately, because there can only be one designated visitor, my sister is the only one allowed to visit. This has put a burden on my sister as she tries to visit twice a week. I have asked if we could alternate monthly. 1 month my sister, the next month me. However, this was refused. My mother can't understand why I don't visit her. I was not allowed to go and do her hair or cut her toenails, even though I have done that for her the past 2 decades. Yet a stranger was allowed to come and do those services. When a grown son or daughter is prohibited, so that's the end of the quote. When a grown son or daughter is prohibited from visiting their elderly family member for months at a time, the government is not saying this elderly family member does not need care. They are saying that they are the ones who should do that care. So how did we get to this point? The family was the first line to be removed when a pandemic was declared. Have we let the government take over our responsibility to care for our elders? Respect for the institutions of church and family is sorely lacking, and it has impacted the freedom of the family and the church to do what it ought to do. But if the state is guilty of taking over this responsibility, perhaps we are also guilty of handing that responsibility over to the government, thinking that would be the easier way. If this is the case, we need to take that responsibility back. So how is the church different? What does family elder care look like in the church? When I ask that question, what comes to mind for you? This is something I've been wrestling with in writing this report. Does it mean choosing a career path that leaves you flexibility to be a caregiver? Does it mean staying in your hometown so you're near your parents when they reach an age that they need care? Does it mean accommodating in your home so that an elderly family member can move in with you? Does it mean taking some kind of training so that you are equipped to know how to bathe someone, dress someone, brush someone else's teeth, administer medications? I would suggest that it is in part all of these things. But above and beyond all that, and the reason it is all that, is the church's call to practice servant-hearted love and understand inherent human value. We live in a culture that fiercely values independence and productivity. Worth is determined by utility, by our usefulness. We can say all we want that this is a cultural influence, but the fact is it lives in each of us too. I was hit by this while working on this report. On the same day that I was doing some research and writing for the report, I was able to shower and dress myself, go for a walk by the river without assistance, make dinner for my family, drive to a friend's house, read stories to my kids, vacuum my house, all the things an able-bodied person can do in a day without a second thought. And I was feeling good about my day because I was checking those things off my list. I was judging how good my day was by what I was able to get done. Rather than resting in Christ as the reason for my inherent worth and dignity as a human being, I often view my worth based on what I can contribute to family, to friends, to work, to whatever else. Probably a lot of you can relate to this. We like to help others, but we do not like to need help or ask for help. We know we are supposed to find our identity and worth in God, but in fact, our identity is often deeply rooted in what we can do. So if you lose your independence and abilities as you age, does that make you think that you would feel like a burden? Will you feel useless if you can't check off a to-do list? Growing old is not just about how others view you, but also about how you view yourself and your identity. As Christians, we need to continually point each other to our worth and identity in Christ. As my mom says, getting old is not for the faint of heart. Aging can strip away much of what we hold dear: our friendships, our physical abilities, work, home, possessions, our independence, and what feels like parts of our identity. As families, we need to remind our elders and each other that dependence is not a weakness. We were created to depend on others. It is not good for man to be alone. Our view of elder care should be shaped by the truth that none of us is designed for independence. Every one of us came into the world completely, utterly dependent, and no one begrudges a baby the care they require for all the daily tasks of life. We recognize this as a precious, fleeting stage, and we know that sacrificial care is going to be required. This understanding should extend across the whole lifespan. Christianity is a religion centered on sacrificial love, on being willing to serve at great personal cost. Caring for elderly family members is an opportunity to demonstrate the deep sacrificial love of Christ for us as his people. We should be thankful that God has entrusted us with this responsibility and an opportunity to care for those who raised us and so witness to the world around us the love of Christ. Society believes that love is a two-way street, that relationships are built on reciprocation. So those who can't help us are not worth our time. They are a burden. The Christian perspective is radically different. Love is about service and about sacrifice. Love is about loving our neighbor as a reflection of our love for God and his love for us. Christianity is about extending help to those who can't help themselves. 1 John 3, verse 16 and 17 explains the depth of countercultural Christian love. It says, "This is how we know what love is. Jesus Christ laid down his life for us, and we ought to lay down our lives for our brothers and sisters. Dear children, let us not love with words or speech, but with actions and in truth." I'm not suggesting this care will be easy. It won't. And it doesn't require sacrifice and humility only on the part of the caregiver. There's a huge responsibility here for elders as well, to be willing to accept dependence, to humbly receive care, and to have patience when caregivers fail. But if the church and the family can approach elder care with this biblical perspective, our care will be different than the world, and it will be a witness to the world. So you're probably wondering, what about this is political? Sounds like only the family should be involved here. But we do, in our policy report, make recommendations for where the government can support this kind of biblical perspective on elder care. So our report recommends things like supporting family caregivers. So this is things like respite, community respite, and in-home care available in communities. And we encourage the development of continuing education programs. So then family members can learn basic home care skills and become better equipped to offer quality care and feel more confident in offering that care. The provincial government in some provinces subsidizes equipment costs for things like wheelchairs or accessible vehicles, and that helps people to stay at home longer, and this should be standard in all provinces. Community support and social connections are also crucial in elder care. Seniors generally enjoy spending time with peers, as most of us do. Social connections such as book clubs, bird-watching groups, Bible studies, etc. have been shown to improve physical and mental health for seniors, and these connections can only be maintained when they are facilitated by available transportation and accessible community spaces. All of these types of policies would support a Christian view of home and family-based care and are something that Christians can advocate for. So while family care and community support are vital parts of elder care, there are times when caring for the elderly is simply beyond the capacity of a family or a church community. And then there is a move to long-term care. So let's talk a bit about long-term care. So the majority of people do not enter long-term care until they're in their 80s. And by then there's usually a majority of conditions going on. There's multiple medications needed. There's a need for assistance with the daily tasks of living. Sometimes there's dementia at play. Just a lot of higher needs involved. But entrance into long-term care should never mean that the family leaves the picture. We can be a witness to those around us by how we stay involved in care. We need to be vocal advocates for family as essential workers in the long-term care system. Nathan Dahl, a geriatric physician, says that family caregivers are an essential part of the long-term care system. He sees their involvement in care reducing mortality. He calls family a shadow workforce and believes they are fully capable of learning and following all the protective measures that professional caregivers take to prevent the spread of infection. We want governments to see dedicated family members as a resource that can help stretch the long-term care systems, not an issue that needs to be managed. During the early months of the COVID-19 crisis, long-term care facilities came under pretty intense scrutiny in Canada. It was known that their occupants were particularly vulnerable to the disease, and it was soon evident that staffing and supplies were not going to be able to meet the demand. But these problems were made much worse by shutting out family visitors from care homes. Care home workers rightly remain professional caregivers, while family and friends should remain the key source of emotional support. So both are essential parts of the long-term care system. There are so many heartbreaking stories that resulted from the lockdown on visitors. While some could apply for exceptions, many didn't know this was an option. And even of those who did apply, up to half of them were still denied access. Consider a wife who came in daily to feed her husband his meals, and now was not allowed in, while staff struggled to keep up, and people went unfed or were fed the wrong type of food, causing choking or vomiting. Consider reports from the Canadian military, who were called in to help in particularly hard-hit care homes in Ontario and Quebec. And they reported unchanged diapers, unwashed patients, dirty equipment, bed sores, and just a sense of fear and despair among residents. Locking down these long-term care homes to visitors removed a crucial support to the formal workforce. And it also took away an informal accountability check. And everyone suffered. Long-term care homes should strive to be places that actually feel like home to the residents. If you've ever looked at placing someone in one of these homes, perhaps you were swayed by brochures advertising outings and activities and large hotel-like lobbies welcoming you. Yet residents often say these are not the primary things they are looking for. In fact, these promotional materials are often geared to the middle-aged children helping to choose a care home. For that reason, the advertising also tends to focus heavily on safety and the safety that a home can provide to an elderly family member. So think about it for yourself. Is this how you want to age, with safety as your main priority for everyone around you? What would make life meaningful to you? What makes a place feel like home? Is safety your first answer? Long-term care homes are too often run little differently than a prison, with people being told what they may eat and when, being placed in a shared room with strangers, being told when they can go to the bathroom, being told what they can eat, and now even whether or not they're allowed to welcome visitors. I think that we have sacrificed meaning and purpose in the name of safety. For many seniors, meaning and purpose are connected to family and social relationships. As one family member said, Since our loved one suffers from a terminal illness and progressively gets worse, we are very sad that she, and we all, missed out on a summer in which new memories with loved ones could have been made. It is a summer that she will never get back, and neither will we. Then she asks, is it worth it? We don't believe it right to make the quantity of life so superior over the quality of life. Safety is not a bad goal, it just shouldn't be our primary goal. If safety is our primary goal, we disrespect the wishes of our elders and treat them in a way we would never want to be treated. Isabel McKenzie, the seniors advocate for BC, says, what are we keeping them, so that is seniors in long-term care, what are we keeping them safe for, if not to enjoy the limited time they have left with the ones they love? Loving our neighbor includes more than just their physical safety. It also includes looking out for their emotional, physical, spiritual, and mental health. Loving our elderly neighbors includes recognizing their history, hearing and respecting their opinions, and allowing them the freedom to take measured risks, whether that's walking on an uneven sidewalk, eating unapproved food despite the risk of choking, or having a family member in to visit during a pandemic. So another aspect of hearing and respecting our elders in their long-term care choices is the aspect of choice in long-term care. So I want to talk about that choice specifically for a minute. The struggles in long-term care during the pandemic have led some to suggest that the nationalization of elder care is the answer. So all elder care would be run by the government and overseen by the government. This is something I advocate strongly against. As we've just seen and heard, family and churches have responsibilities in this area, and we cannot let government be the only voice. So there are a wide range of elder care options around right now. There's for-profit, not-for-profit, public, private, and there's no evidence that any one of these consistently offers better care than the others. So a primary recommendation in our policy report is that all levels of government must respect and support the value of choice in long-term care. This applies particularly to care homes that meet the specific cultural or religious needs of their citizens. Our elders should be able to grow old in a place where they feel valued and cared for and confident that their beliefs are respected. All governments should ensure strong conscience protection rights for private care homes. Many seniors do not want to live in a home that's going to offer them euthanasia, and many homes do not want to be forced to provide euthanasia. Taking away choice in long-term care means that these things can be forced. Of course, all long-term care homes should be subject to public health inspections and held to a very high standard of care. But the government involvement should not go beyond that. They should never be allowed to insist, for example, on the provision of medical assistance in dying. In the Fraser Valley, we recently had a case where a local hospice was required to provide euthanasia or lose their funding. This is a type of government overreach that limits freedom of conscience, and we should be willing to take a stand against it and stand for the choice to operate private long-term care homes that allow us to care for our elderly in a God-honoring way. So you've just covered quite a bit. It's quite a bit of information. So what are you going to do with all that information? Hug your grandma a little tighter the next time you're able, I hope. Maybe call your dad or send an email to a couple seniors in your church who are probably feeling pretty isolated right now. Reach out to someone you know who cares for an elderly family member and see if you can run an errand for them and help lighten their load there. Like I said at the beginning, this is a topic that's close to many of us, and we all have these people around us. But what about bigger societal changes? How can we bring this biblical perspective of elder care to our civil governments and advocate for our involvement in that care? In this report, we make recommendations to all levels of government. One colleague said I may have set a record for most recommendations in a report on one issue. So I encourage you to check out the full list in the actual report on our website. But here you can see quite a few of them. And what I really want to focus on today, especially is in the middle there, the provincial government. Our primary focus with this report is going to be the provincial government. The provincial government is responsible for healthcare spending in the province. So they also oversee long-term care homes, home care services, assisted living facilities, hospices. They have the ability to provide funding for respite care, for aids such as wheelchair and hospital beds. They can improve day programs for seniors, and they can designate family members as essential workers in long-term care settings. There's a lot of room for both our government and ourselves to impact elder care for the better. So we're all aging, and we need to speak up for a system of elder care that goes beyond maintenance to meaningfulness. As image bearers of God, we are created and sustained for as many days and years as His purpose requires. And we know that human dignity cannot be lost. Elder care should focus on honoring the aged and affirming their inherent worth. And as Christians, we have so much to offer to this discussion on elder care. And I hope that we can use every opportunity to speak truth and love in this conversation in Canada. So we're just going to readjust here, and then Andre's going to join me, and we're going to take some questions. So if you have any questions coming out of that, or comments or thoughts that you want to share, feel free to put them in the comment box and we will try to get to them. Andre's got his tea. We're getting all sorted. And I probably talk too fast, so if people have clarification questions, that's fine too. Back up a little.
All right. Well, as we get settled in here, Anna, first of all, thank you so much for all of that information that you were able to pack into our discussion, into your presentation. I think that it was very, very helpful, and it's a new area of that we've gone with our policy reports. So I just actually got for our viewing pleasure for our viewers, we've got the new report. It just came out. So it's elder care. So it looks like it's on our website. You can download it. I think our colleague Colin just posted it in the comment bubbles as well. So if you want to see an online version, it's also been printed and distributed to all, or will be this fall. It's going to be distributed to all MPs, senators, MLAs, MPPs across the entire country. So almost 1,000 politicians are going to get this report as well. Okay, so let's see. We got a couple of questions that have come in, so I'll be monitoring those as well. But I want to start with what you ended with, Anna, about from maintenance to meaningfulness, because it's such a powerful short 4-word statement, and I think it basically summarizes the whole policy report. So I'm just wondering if you can comment a little bit more about that, like discussing particularly the word meaningfulness. Like when we talk about elder care, living our last years well, what would you say would epitomize a meaningful existence that we could maybe communicate better to a society that is not really Christian? It's not a Christian society, but how can we talk about that a bit more?
Yeah, that's a really good point, because I think the maintenance thing that I'm mentioning is just the idea that we want to keep them safe. We want to put them somewhere that they're safe, and then their families can go on living their lives and know that they're taken care of. The idea of meaningfulness is, how do they actually want to live those last years? What's their history? Are they someone who loves to have visitors? Are they someone who loves to go bird watching? Are they someone who loves to read? Can we have someone read to them if they're no longer able? Finding ways to, with each individual, say what made life meaningful to you? What did you enjoy? What brought you joy? And how can we keep those things going through all your years, not just as long as you're able to do them yourself?
Right. Yeah. And I can't remember if it stayed in the final version of the report. Maybe it got edited out at some point. But you talked about how when we choose the type of long-term care or just retirement care, perhaps for our parents, sometimes we think about things that we wouldn't choose for ourselves. You certainly were making reference to that towards the end of your presentation as well, where we choose. Let's make sure safety. You raise safety. As maybe middle-aged adults choosing care for our parents or our grandparents, we say, oh, we want to make sure it's safe, instead of that not being our primary consideration when we think of our own homes. I thought that was really important that you noted that. And can you maybe comment a little bit on that in relation to safetyism and also autonomy? The great value of autonomy. We're hearing a lot about autonomy right now in our cultural debate around C7, the expansion of euthanasia bill. Are we considering autonomy enough when it comes to long-term care? And are we maybe considering it way too much when it comes to things like assisted suicide?
That's an interesting point, because in the original draft, I had written a few times that we wanted to respect the rights of seniors. And a couple of our colleagues said to me, don't use the word rights, because that's language of the world to say this is an autonomous right to choose what I want here and there, that focus on choice. But I think the reason this focus on safety is often people are looking to have someone move to long-term care because they're worried about their safety at home. So that's front of mind for them in terms of them staying home, is that's not safe. So then the alternative is, oh, this is safe. But actually, the safety is a secondary issue. You want the physical safety, absolutely. But then looking at that meaningfulness, and that also autonomy would play in there, saying, how do they want to live their life? What's their choice there? And how would I want, when I'm that age, would I want someone to tell me how I'm going to live my life, or would I want to have still a say in that? So I think there is room in a Christian perspective to say there is autonomy, should be respected for individuals. And that's the idea of taking measured risks and them saying, I want to be able to do this, and I'm aware of the risks that come with that. Euthanasia would be quite a bit further, taking the same idea, though, quite a bit further, you're right.
Yeah, exactly. I think, and that's the problem, is when we take one concept and we view the entire, all of life through that one concept, or the subject, the person in front of us, we analyze our decisions through one lens. So, only focus on safety and it's going to lead to a bad result. Only focus on autonomy, it's going to lead to a bad result. We have to have a holistic approach. And I liked as well where you were going with the discussion about long-term care in the age of COVID, and how that's resulting in problems, particularly when family members are locked out from caring for their loved ones, even spouses, husbands or wives prevented from ministering to their spouse, or children ministering to their father or their mother. Like, that's particularly troublesome to me. And I think, like, when you were talking about it, it made me think again about the definition of public health. What do we mean by public health? It's not merely the absence of disease. It's not merely keeping a senior citizen safe within a long-term care home. But public health, if we want to have a healthy senior living in care, we need to think about more than just their physical safety. We have to think about mental health, emotional health, spiritual health, relational, social health, and all of those measures. And I think that's so important to remember. And it seems to have been missing in the last 8-9 months.
And I think it's not something we should be expecting from professional caregivers. And that was a point I wanted to make too, is that professional caregivers are meant for the physical safety. They're there to take care of those physical needs. But shutting out family means all those other aspects of health. We can't just put those then on professional caregivers and say you're now also responsible for their emotional health. That's too much. But then I think that's where, and same even with just having one visitor allowed in, that's a burden on both the senior only allowed one visitor, as well as the person trying, like the story I shared, trying to visit twice a week and not having any support that way either. So I think like you said, taking that holistic approach and saying no one person can deliver all of this. So a care team approach, and having family be considered essential workers. Like he mentioned, that anyone can learn to wear the protective equipment, to follow the right protocols. It's not that family members are unable to do that and would be unwilling to do that. They would be happy. They want to keep their family members safe, as we talked about, and everyone else in the home, but just finding a way to incorporate them into that care team as essential.
Yeah, and so maybe we can talk just a little bit about that, because it's been a problem through the last 9 months that family has been treated not as essential. But I think that there's been some moves, at least in Ontario, to introduce bills, laws, regulations, something like that. Maybe you can comment on that, to recognize family members as essential caregivers.
Yeah, so Ontario has, in response to the COVID issues that came out of the lockdowns, they've introduced the More Than a Caregiver Act, which is basically to make family essential workers. So we'd love to see all provinces follow suit. And that's why I say this provincial focus, because each government will make that decision on its own. But it is something that I think a lot of people see the value in. The Seniors Advocate in BC just put out a really extensive report on it as well, really recommending that we start making changes in the lockdowns. So I think they're seeing the results that aren't good and trying to.
Yeah, I think I recall seeing a survey maybe a month or so ago from British Columbia, where senior citizens were surveyed, what would you prefer, lockdown and being safe, or maybe taking a bit more risk as it related to COVID, but being able to see your own children, your own grandchildren, socializing with them, and so on. And an overwhelming majority, if I remember the numbers correctly, were in favor of, look, we'll take the risk. We're willing to live with a bit of risk if it means we can see our children and our grandchildren. And that goes to, a message our colleague Tabitha brings up all the time, that we were meant for relationship. We're social creatures, and I think that that's so important. We have to have a proper view of who we are as human beings. If we miss that, if we forget about that, then it leads to bad public policy. Maybe you can comment on a headline I read just on Friday morning from CTV News, where a 90-year-old woman was terrified of being locked down again. She did not want to deal with the isolation of another lockdown. And so because she didn't want to deal with that, she requested MAID, medical assistance in dying, and she was given it. It was given to her. So she said, you're locking me up. You're keeping me isolated. I can't bear the thought of living with that anymore. I want MAID. I want assisted suicide. And our system somehow thought that the answer to her request was to give it to her, to give her assisted suicide. And so the article opens with what is an attempt at some romantic picture of how she died, but is actually eerie and very disconcerting. And it's that a crowd of people, so apparently we're keeping her isolated to keep her safe, but for her death we can gather a crowd of people around her and they can sing her a song as the doctor gives her a lethal injection and she dies in the bed surrounded by family and friends. But have we lost our minds as a culture, as a society?
It's mind-boggling. It is, and I think it is. It just speaks to the huge cultural currentness of euthanasia. To be like, we are getting this through at all costs, even when it makes no sense. And it's clear that we are not just murdering someone who's really choosing it, but we are actually facilitating that. We're putting them in a situation where they want death, and that's on us as much as on a person asking for aid. And I think that it's so sad to think that they can bring the family in for death, but not for life.
Yeah, we completely inverted our priorities.
Yeah.
So in your talk this afternoon, as well as in the policy report, there's quite a bit of information on a lot of emphasis and focus on the family as primary caregiver. I think that's excellent. We'd spend quite a bit of time with recommendations and policy suggestions for the civil government. What about the institutional church? So, I mean, so the church is the body of believers living and acting in all spheres of life, but what about the church proper as an institution? Are there some creative ideas that we could come up with that the church itself could do to improve elder care? Like one example might be perhaps it's for a church to say, we're going to hire a palliative care nurse or just a nurse with a specialty in geriatrics and in caring for people in older age. And that nurse will be on church payroll, but that person is going to minister to the local community where a church is located or to the church itself, those kinds of ideas. Is there a role for the church to play in that?
That's an interesting idea, yeah. And I think there's tons of role for the church to play. Like I say, we all have these people in our communities. I live in a neighborhood with quite a few elderly people who don't have family support and who don't have a lot of connections or friendships because as they move on from work and retire, they don't have those connections, so they're quite alone. So I think there's a huge opportunity for the church, each individual church member in their own neighborhood, but also the church in general, even in how they care in their own church. So if someone were to say, I want to be a caregiver for my elderly parent, but I financially can't work, for the church to say, no problem, we will come alongside and make sure that financially you have no problem doing that. So I think there's a lot of room for, and just supporting each other, visiting seniors and getting to know them and finding out what they do want, what does make life meaningful to them, and trying to help facilitate that. But I'm interested in those broader ideas of going into the community in a larger way, which the church used to do. And I think that's where the church used to have responsibility for a lot of these things the government now does. So it's kind of figuring out which ones we can take back.
Yeah, for sure. I'm deep in this conversation with you. I just realized, oh wait, I'm supposed to be checking if there's other questions coming in. So I'm just going to double check. Oh boy, yeah, there's been a few. I'm apologizing to our viewers. There's a couple of questions here. So one question is, let's see here. Oh, I got a lot of comments. So from somebody, we have a comment from Sarah who says the phrase "not maintenance but meaningfulness" is powerful, but does that not play into the idea that when quality of life is not acceptable, then MAID becomes a viable option?
That's a good question.
Yeah.
Well, I think that's where the church is also different in that we don't see suffering as meaningless. And I think to be able to find meaning in suffering is something that maybe you need your church community around you at times to support you and point you in that direction. But the world would say suffering is meaningless. At this point, your life is meaningless. Is not meaningful. You're just suffering, and this is horrible, and it's not going to get better. Whereas we would see, what is the purpose here? Is it for me, or is God teaching something to people around me? That there's meaning in every day of life that God gives us, and we as Christians can find that together, not always on our own.
Right. Yeah. Okay. Like that. We have another comment. What are we keeping them safe for, if not to enjoy the years they have left? That was such an important question. And this year, says one commenter, that this year's brought that into such clarity. What is happening is a horrid experiment in human care. And that's a fair point as well.
Sad, yeah.
Let's see. I'm very new with technology here. I should have done a better job of knowing how it would work. There's a couple of other comments as well. Another thought I had, another question I had as we were just talking about the role of the church. And again, to our viewers, if you have questions, please pop them into the comment section underneath the video. Another thought I had was, again, thinking of the mission, the institutional church as it relates to elder care. Do you see, speaking maybe about demographics first and then anything else that comes to your mind, is there a missional opportunity here for the church, an evangelistic opportunity for the church when it comes to elder care?
I would say absolutely. And I think it depends also where your church is located. Like our church is located very close to a senior's home in our community, and we've often said that that would be an amazing mission ground. Mm-hmm. And we have some church members who live in there, and they say too, there are people who move in who have no one to help them move in, and it takes them days to move all their boxes. Like if we could just get a couple church people over here, it's just like those contact points and that sense of community and that sense of people who recognize that they have inherent worth just for the sake of being, because they're created in God's image. And there's nothing that they have to do to earn that, so to speak, that earn that usefulness. So what kind of evangelistic opportunities? I feel like you have something in mind.
Well, I mean, I'm just so first of all, demographics. You say right at the beginning of your report, the elder care policy report, that in 2015 the number of people who are 65 and older increased or grew larger than the people 15 years and younger. So seniors have outnumbered children for the first time in Canadian history in 2015, and that by 2025, I think you said that the number of seniors in Canada is going to double. So demographically, there's a huge swath of our population who are seniors. And again, if we look at just the Canadian population in general, a lot of them are not Christian, or perhaps they're lapsed Christians, like that they maybe went to church in their younger years, but have kind of, in the busyness of life, raising a family, pursuing a career, and all of that kind of stuff, forgot about church and forgot about God. And now they're seniors, and maybe the friendships have passed away, or family members are maybe further away, and they don't have those connections and so on. And it seems to me that often our missional focus is on children programs, or neighborhood outreach, or reaching to the down and out. All good, all great, but perhaps we should also see elder care and ministry to seniors in particular as another field that are worthy of pursuing.
I would definitely agree. Yeah.
Okay, and let me see if any others came in. A question. All right. I think we can leave it there. I had one other question that had to do with family, So I had written all kinds of questions, but they're out of reach. They're just off camera over there, and so I'm going all totally by memory here. We'll see how it. Oh, thanks, Daniel. There was one other one about family caring for in long-term care and so on. Sorry, and I'm going to try and remember, and it'll probably never come back to me. Oh yes, that's right. This is it. So it's going to be an uncomfortable question, because I think I'm asking you to criticize ourselves, our own churches. And that is, it seems to me when I look at Eastern cultures, so Sikh cultures from India, also Chinese culture, the Japanese culture, that there's a very high regard for seniors, for elders. And you also see, and I think you see this actually quite a bit in the Lower Mainland in BC, that there's actually quite a lot of intergenerational homes. And when I read the biblical narrative and the little bit I know from ancient Greek history and ancient Roman history that I studied in my undergrad, that was very common, intergenerational homes. Because you talked about it in the report as well, that we give tender care to little infants, and we don't begrudge the infant for the care that we have to give them, and then we become young adults and adults in the prime of our life, let's say, and then we give out care, and then we become seniors and we can receive care again. So we receive care as children, give out care as adults, and then receive care again as seniors. And that's just the arc of life. And when you live in an intergenerational home, you can be giving and receiving care, all at the same time. All of that to say, have we as the Western church, and this is where the criticism perhaps comes, have we missed something? Are we doing something wrong? Like, is there, maybe this is saying it way too boldly, so feel free to push back, but is there maybe even something that we need to be thinking of repenting from when it comes to the way we live our lives, individualistically instead of communally, materialistically instead of generously towards the other, charitably towards others, when it comes to elder care. And I'm just thinking for myself, if I think about myself, my siblings, my parents, I don't think we've ever had the conversation about, hey, can one of us have our parents to live in our home with us, and how can we support each other to make that decision, however that is, just so that we avoid the type of stuff that we see happening in long-term care homes for the last 8-9 months.
Yeah, it's a really good point. And I think it's interesting that you talk about, like, maybe we should discuss that now as family. Like, when your parents don't yet need care, maybe that is a better time to discuss it than the pressure of, like, they're no longer safe, what do we do? And I think that would be a huge shift in our community already, to think, how am I going to structure my life so that I'm able to care? Or how am I going to work with my siblings so that we're able to care, and to talk about it before the need is there, I think would be a huge thing. What I did find interesting in my reading was that it's not even so much a Western versus Eastern culture thing, as much it was an income thing. So I think in every country they found where seniors had the financial independence to not live intergenerationally, most of them actually chose not to. So what we're seeing is a really interesting, say like 65 when they're empty nesters to 75, 80, they really enjoy being on their own. They like being with their peers. Their retirement communities are a huge success because people, they wanted to be with other retirees.
Right.
But then when they reach a point of care, needing care, there's actually been that gap of 10, 15, 20 years where they haven't been as close generationally to have the relationship with their children and grandchildren that makes moving in easy. And I think that we have kind of, I would say where we've really lost it is in including the grandchildren, because often the children feel very responsible to care for their parents, but in, say, like the Sikh community where we live, a lot of the grandchildren, that's just an expectation, that it's like, you're 18, 19, you have a license, you're driving grandma to her appointments, and you're doing those things, and it's a beautiful thing. It's just part of their responsibility. They don't think anything of it. So I think we could do better in just raising ourselves and our children to just know that this is a duty and a Christian responsibility, and also it should be a joy. Like, that's why I talked about too, that it is an opportunity God has given us to care for the vulnerable. And in the Old Testament, they went to exile for not listening about that. So I think it should really be that defining characteristic of the Christian community, that we are caring for each other. And like I said, sometimes that has to be in a long-term care setting. I'm not saying families should be able to handle every kind of complication that arises,
for sure.
but that they should stay involved, and it shouldn't be that you're dropping people off at the care home and that's it. So
for sure.
it's definitely something to consider, though, I think, each individually, for sure.
Okay. So now, as we wrap it up, then let's go to forward action, because ARPA Canada, the last A in ARPA is action, the Association for Reform Political Action. And we want to not just have a nice conversation between, a couple of policy nerds here about, how to better do elder care in this country, but we want to actually make change for the better for all of Canada, to bless fellow Canadians and to help our civil government make good decisions. So is there anything coming down the pike as far as that goes? Is there things that our viewers should be aware of and ready for when it comes to elder care in Canada?
Yeah, so we are hoping in the new year to run kind of a mini campaign on elder care specifically. And we do really feel like in this mini campaign, stories are going to be crucial. So stories, are you in a home that's run by the church and you love having that choice to be able to be in a Christian care home? Maybe you want to speak to that, the choice in long-term care. Or do you have an elderly family member who needs more home care support than you're able to give? Do you wish there was more community respite support, people who could take over for a day while you run errands, or looking for those kind of things? So really those stories of like, what would help you care for your elder and also benefit your community and also respect seniors' wishes, like all those things. So and how has the COVID lockdowns impacted you? How important are visitors to you? What makes your life meaningful? What are those things that matter to you when you're in your final years? So those kind of stories we'd love to see, and just really communicating with our MPPs and MLAs. There are recommendations in there, even at municipal level, to say your mayor or your councillors, like, we need more accessible communities. There aren't a lot of doors with automatic openers, things like that. We need more extra time to cross at crosswalks. All these little things that can make communities more accessible. Our municipal governments should understand that that'll benefit everyone at some point, whether they end up on crutches or whatever the reason may be. Those are just good things to have in a community. So yeah, there's going to be a lot of recommendations like that coming up that we're hoping people can also really relate to and share their personal story, not just a generic email, but to say, this is why it matters to me and my family, and this is why it would make a difference for me. So I'm hoping that the action will be very family oriented.
Yeah, good. Well, let's wrap it up there. Thank you so much, Anna. The research and drafting of the elder care was great. You're the principal drafter of this one. I mean, obviously it's a team effort with other members of the team giving input and edits, and you also passed it to external reviewers, right? There's people outside of our organization who have expertise in this who also gave feedback and recommendations. To them, we say thank you as well. And we turn it over to you, our viewers and our friends and our supporters. Do take a look at the elder care report. The hyperlink's been added to the comments section. Give it a read, share it with others, including your MLA or your MPP, asking them to act on this as well. And together we can hopefully improve elder care in Canada. So thanks so much for watching. Thank you again, Anna, for the presentation.